Okay, right. So as you've already heard, I'm going to be talking about translating allergen management limits into practice, the way I've sort of manipulated the title slightly. And I thought, actually, there are a number of ways of doing that. Could talk about how we manage allergens directly in a factory or something of that sort, but I've chosen a different approach, which you'll see, and I hope you like it. So the outline of this particular presentation is in 4 parts there. First of all, I'm going to talk a little bit about where we are with limits for allergens, thresholds, reference doses, and so on. What's the current status, broadly, and what are the issues that are still arising? And then, why are they needed? And what are they meant to achieve? I think it's useful, actually, to take a step back sometimes and think about those particular issues, saying, what are we trying to achieve, rather than just go down to the very great detail. And then, how can we effectively use those limits? And in particular, of course, application to precautionary allergen labeling, which is the one that causes most work and discussion and so on. And I'll finish with the current developments in Europe, actually, in relation to the new regulation that we've had, the 1169/2011, that's been coming into force bit by bit. So first of all, yes, current status and issues. Whoops, should have gone. These are some of the considerations that I think we need to think about when we translate any limits into action. How we translate the risk assessment to protection of public health. Because what we need to think about are some of the constraints. Feasibility within regulatory and operational constraints, for instance, and in particular, and I think specifically here, of precautionary allergen labeling, and I think you will already have a taste for some of the issues, avoiding unintended consequences. Because, of course, in theory, yes, it could protect everybody. It doesn't, as I'll show. Then there's a need to balance potentially conflicting requirements. Yes, we need to protect the allergic consumers, but there are other effects which we need to think about. Does what we do actually have an effect on other safety parameters? So if we introduce wet cleaning regimes in places where they are not normally found, and where the equipment perhaps is not optimal, you can easily have an issue with microbiological safety, something you certainly don't want to have. You might say it's an unintended consequence as well. Then, of course, you've got environmental consequences, particularly in the context of sustainability, which is very much at the forefront of our minds these days. Waste, associated issue. And then thinking about how adequate the protection that is afforded is, and in particular in the context of overuse of precautionary allergen labeling. Quality of life for allergic individuals when they have to interpret all these multiple statements that they see on the pack. So, yes, just a few obvious statements here. Food production obviously involves the deliberate use of allergens as ingredients. We're not going to get them out of the food supply. Milk, egg, and so on are valuable nutrients, are present in many products, so you can't just avoid them. That's one thing, unless you have a very specific process. And then secondly, of course, and this is the issue which concerns us, this unintended presence of allergens in products, despite all the measures taken to avoid them. And as you've heard already, and as you know, there has been a legal and regulatory response to the issue, which started off, I suppose, in the 90s, or began to grow from the 90s, actually, when it was realized that food allergy really was a food safety issue and not just one of those idiosyncrasies which individuals have to cope with. There were far too many implicated in that. The response has been, of course, when we think about ingredient labeling, it's strictly hazard-based. So, as I said, that particular train has left the station. If it's there, so if the ingredient is present, it must be labeled. It doesn't matter whether it's 1 part per billion, 1 part per whatever number that you want to put. If you're actually deliberately putting it in the product, then you have to label it. there would be arguments for changing that, but we're not going to go into that at the moment. But there's also this varied and often poorly defined, the response has been varied and often poorly defined, actually, for an intentionally present allergen. And of course, those account for the most salient safety issues, as I think you've already appreciated from the presentations today. And this has consequences, which I'll go into more detail into later, but some of those are lack of harmonized approaches for assessing, managing and communicating risk. So those lead to diverse standards, dependent on, well, I'm sorry for using a European acronym there, Food Business Organization. It's just an EU acronym, actually. So it's dependent on the Food Business Organization's knowledge and understanding and risk perception, and it lacks transparency. And that does have consequences, certainly, in terms of precautionary allergen labeling. There's no agreed single consistent level of safety which everybody's agreed on for allergen across food products. Inconsistent standards for application of precautionary allergen labeling. And of course, you might say, well, yes, that's going to happen. Consumers are confused. And when they're confused, they don't know what the meaning of those of the terms or the labeling is, and they lose trust in the safety of products. And we do know that actually there's a loss of credibility of precautionary allergen labeling wherever that particular phenomenon has been studied. And I would argue actually that that's serious, not only in that particular sense, but I mean it's not good from a reputational point of view for industry certainly, or anyone else, but also it increases the risks of food to allergic consumers, and I'll mention why later. So why are they needed? What are they meant to achieve? As I say, it's useful to remind ourselves of what the purpose of those limits is going to be. And I think the primary purpose actually is to protect allergic consumers effectively by minimizing the incidence of reactions. And I'm not saying eliminating reactions, because I think that's going to be impossible. So minimizing is very important in that context. And it does actually drive the particular approach which we need to think about. Of course, and that's fairly important, I think, also, although it's not the primary purpose, it will protect food business operators if well implemented as well, clearly. And how will those limits do it? Well, by providing a single consistent benchmark for allergen management. Decisions by food business organizations relating to unintended allergen presence, including the application of PALS. So it's not just the application of precautionary allergen labeling, but also the other aspects of risk mitigation and so on, which were discussed this morning. Also, by fostering good practice in assessing the risk from unintended allergen presence, and of course, ensuring that precautionary allergen labeling's value is actually restored and maintained so that it becomes again, hopefully, an effective tool. Now, we know about unintended allergen presence, and I'm not going to go through in detail here through the diagram, but just to say, obviously, the allergen is not an ingredient in these circumstances, and the presence can arise at any stage within the food supply chain. As I say, I'm not going to go into the whole detail of where it can, because I think you'll already know that. But also it's important to note as well that the presence varies according to the production process. Different production processes are differently vulnerable, apart from anything else. It varies according to the source of the unintended presence and the physical form of the allergen, readily dispersible, for instance, or particulate. And the quantity present varies and could be, for instance, a very low level of allergen in all units of the product, that's a particular situation, or only occur in a proportion of those units. And when the allergen is in a particulate form, of course, most units may not have any allergen, depending on how frequent the pieces are. But where it occurs, it may be of sufficient to provoke a severe, possibly even fatal reaction. so resulting in a rare event, but with very serious consequences and something no one wants to have. So that does pose a dilemma as to how many, as to how you deal with it. Now, it's interesting to see actually, to consider what the presence of a precautionary allergen labeling statement means. And this is a slide actually which was devised by someone I work very closely with, Sabine Schnatt of the German Allergic Patients Organization, and which is also reproduced in a paper which we recently produced as part of a project in which we, and Steve as well, is also a partner, which is called IFAM. So let's look at what happens, what the situation with when you've got a precautionary allergen labeling statement. Well, it may be a product with a, if the risk assessment has been done properly, then the product with PAL poses a real risk of inducing an allergic reaction, i.e. it's not safe to consume. And the result, and the reason why it's got PAL is because a proper risk assessment by the food manufacturer has been undertaken, and the conclusion has been drawn that the amount present is actually such that it would pose a risk. But there's a second category, which is that actually the risk is, the level of risk is unknown actually. So it may be safe or it may be unsafe. There's been no proper risk assessment, or the allergen may or may not be present in the product or in a sufficient proportion of the products. Similarly, if you go on the other side with the product without precautionary allergen labeling, it may have low or no risk of inducing an allergic reaction, i.e. it's safe. Again, you see the proper risk assessment has been done, and the conclusion is supported by proper evidence. And therefore, the conclusion is that the allergen is not present in the product at a level that is likely to cause an allergic reaction. And typically, such a product would have been assessed according, for instance, to vital to reference doses. But there's also another situation where actually the product without PAL could actually be quite very dangerous, in fact. It may have an unknown risk of inducing an allergic reaction. So it may be safe, or it may be unsafe, or it may not be. And again, it's a similar situation. So faced with that sort of situation, the consumer is put in something of a quandary, and it is not surprising that they display certain behaviors which are not what the intention is behind the use of precautionary allergen labeling. So if we think about the allergen management, oops, I've gone too far there. Allergen management and precautionary allergen labeling, industry is uncertain about how much to do in managing allergens in the absence of established limits, and where not to use or not use PAL. So if you actually don't know what the limits are, it's very difficult actually to communicate with the consumer whether a product is safe or not, and other stakeholders as well. When I mean other stakeholders, I'm talking about physicians, for instance, who have to advise allergic consumers. And the advice that is given, certainly in the United Kingdom anyway, and many other parts of Europe, actually is very varied, varying from don't worry about precautionary allergen labeling to avoid everything which has got it. Yet again, not a situation you want to be in. So it is not surprising that precautionary allergen labeling is failing currently as a risk management tool because of this loss of credibility. And the reason for this loss in credibility is a proliferation of injudicious labeling practices across industry. And I'll give some illustrations of those in the next few slides, actually. But also, just to substantiate the statement, that actually it is it is failing. It is failing because people with allergies are not avoiding their allergen necessarily. So, for instance, if you have the statement may contain, you look there, the Ben Shoshan's study. The statement refers to never purchase if labeled. Well, 50%, well, 55% never purchase a product having a may contain, I mean, who are allergic to that. But that means 45% do. Those 45%, in the light of the preceding slide, the couple of preceding slides I mentioned, actually are potentially putting themselves at risk. And the message is similar to a study which we conducted as well, actually, together with the anaphylaxis campaign, actually. Again, always avoid may contain, actually in this particular study, only reached about 35%. So 65% at some point or another were deciding that may contain really wasn't something to worry about. Now, if of course the risk was low, that wouldn't matter, but it isn't. Oh, yes, these are some of the illustrations. Some typical products. Thankfully, these particular, those two certainly are unbranded anyway, and they're sort of things you find in, I don't know, cafes and so on. But you find here, in this particular one, similar with the other one, among the ingredients are 2 Annex 2 foods. So Annex 2 is the list of allergens in the new regulation, so same as Annex 3A. But there are also 9 Annex 2 foods which are possibly present. Given that Annex 2 has 13 foods plus sulfites, that means there's most of the list in there, which might, if you're a consumer or anybody else interested in food safety, make you wonder about what sort of processes they use in that particular establishment to produce this product. Another situation is where you have a statement which is not really expected for that particular type of product. This particular product, well, you can't see much of exactly what it is possibly. It's sparkling spring water with a hint of lemon and lime flavor. That's what it says. And the allergen, I think the allergen advice, which I can't read from here anyway, but I remember correctly, the label says, cannot guarantee that nuts are not present or something similar. Now, I think it would be, should be rather easy to guarantee that nuts are not present in something, in basically what is mineral water. So it is unexpected, and those are the sort of instances that cause all this loss of credibility, this lack of trust. So it is serious. So, yeah, these practices are driven by, yes, confusing terminology as well, giving the impression of a risk hierarchy unsupported by experimental evidence. And in another presentation, which I'm actually preparing for another event, I'm looking at a study which was recently conducted, relatively recently conducted by the UK Food Standards Agency, or commissioned by them anyway, in which there is a list of, I think, 39 different statements. Broadly, I think there were 7 main ones, and then a whole load of other ones, and some you would barely believe, actually. But one can have a chuckle at them, at least. So, confusing terminology. Yeah, lack of transparency over its use. So, when is it not used? What does it actually mean? Also, and I think we've heard that as well, faulty beliefs among consumers concerning the framework in which it's used. There is certainly in the United Kingdom, according to studies, a belief that actually among many consumers that the use of precautionary allergen labeling is mandatory, same as general allergen ingredient labeling, whereas it isn't. It isn't even in the new regulation, actually, within the European Union. So that is a faulty belief there. And then inappropriate use, well, you've seen that anyway. Lack of agreed standards for application, no harmonized risk assessment. But, okay, as I said, it does lead to risk. So, yeah, and sometimes actually it can lead to very serious consequences. And this one is one from earlier this year, actually, in which somebody was, according to all reports, quite diligent about avoiding his allergen. Eventually, because in fact he'd actually taken, eaten some of the chocolates. Eaten some of the chocolates from a particular box, and not experienced a reaction. Had concluded they were all fine, despite the fact that there was a precautionary allergen labeling on the particular pack, and eventually, suffered a fatal reaction. So it is really serious. So, I think that certainly is a good support for a case for limits. But how can we effectively use those limits once we've actually defined them? and particularly how do we apply them to precautionary allergen labeling. I think it's important, actually, and for many years I think it was not properly appreciated. And that's why we've ended up in this zero tolerance situation that Steve described this morning. It's important to realize that, yes, food allergens in many respects are not too different from other toxicants in that sense. As the dose increases, the probability of no or slight effect actually decreases up to the point, actually, obviously for an allergic person, actually is virtually certain. And again, I would say also, and I think there is evidence, that the probability of a severe effect is also increasing all the time as well. So in those particular circumstances, it's useful to consider actually what factors we need, how we can minimize the risk, and actually what factors influence it. So if we look at the proportion of products, if we have precautionary allergen labeling, and I should hasten to add before anybody wonders, these are purely arbitrary units. That's why I have not put any units on there. They're just arbitrary numbers for the purpose of illustration here, of building this particular graph. So actually, yes, you've got the red line indicates the proportion of products affected as you decrease the reference dose. So if you push it way, way back towards the left, obviously, for a given state of technology that you're able to achieve, you will have more and more and more precautionary allergen labeling. On the other hand, if you look at how the extent to which those who are supposed to observe that particular allergen labeling, who are supposed to pay attention to it, do so, you find that clearly the more products are labeled, the less well they observe it, actually. And that's why you've got the green line on this particular side. Again, those are arbitrary numbers until we can populate such a figure. And what you get eventually, what you eventually end up with is a risk profile that looks something like that. It could be flat at the bottom. It could be over an extended range, of course. But effectively, you've got an area. The skill will be in actually identifying the area which corresponds to this minimum risk, let's say. And effectively, actually, this is the sort of argument that the FDA actually used in relation to the establishment or the adoption, should I say, of the Codex threshold for gluten versus the figures that they derived at through their health risk assessment in another document, actually. Because I thought it was worth bearing that in mind. You've seen the Vital 2 reference doses already, so I'm not going to go through them in any detail. But what I would like to take you through a little bit, actually, is to give you some feel for where they fit within the range of doses that provoke reactions, actually, in allergic people. This is one particular, well, this actually refers to a particular study. In 2003, there was this particular report in Mayo Clinic proceedings of a severe allergic reaction to shellfish induced by a goodnight kiss, actually, what they described as an intimate kiss, actually. And that prompted some researchers, actually, to look to see how much allergen could be transferred under those sort of circumstances. Now, they didn't exactly replicate the experiment for, I think, fairly obvious reasons. But what they did is take some not peanut allergic people. They took peanut and they took some non-allergic individuals, got them to chew on the peanut, and then measured how much, and I think swallow it and so on, and measure how much allergen was present after various times. And what they found actually, and therefore how much could be transferred. And what they found was that it corresponded to between 8 and 37 milligrams of peanut protein, which, if you look at where it fits on the dose distribution here, which you've seen before, I'll get them all those numbers up, it was anything between what we would call an ED18 roughly, and an ED39. So in other words, between... Sorry? I don't know what that is. Some intervention. that would so that would mean that at the lower end, that would correspond to a dose which would provoke reactions in 18% of people with peanut allergy, or at the higher end, 39%. Another study, different sort this time. This one's from peanut oral immunotherapy study. And all I want you to note from this, I mean, got the details there, standard dose escalation from 0.5 milligrams to nearly, well, just over 2 grams of peanut protein. What the authors observed were only a small percentage of mild reactions up to 0.4 milligrams of peanut protein. Remember, 0.4 milligrams of peanut protein is already twice the vital 2 reference dose. Okay, we'll leave those ones. But no severe symptoms below 25 milligrams of peanut protein. So that's, about 50 times more than, no, more than 50 times more actually. 125 times more than the vital 2 reference dose. So it gives you some idea of the margin, or what one might call the margin of exposure before a significant reaction might be experienced. Now, Steve did say that it would be unethical to push people towards a severe reaction, but some people have done an experiment along those sort of lines, obviously with full consent. And this is a group in Australia who did this. They gave peanuts to peanut allergic individuals until they actually developed anaphylaxis. And in this particular circumstances, they found that anaphylaxis developed at a cumulative dose of peanut from 0.02 grams, so 20 milligrams, to 11.7 grams. So from 5 milligrams to 2,750 milligrams of peanut protein. And just to emphasize the point, that lowest dose is 25-fold, the vital 2 reference dose, rather, is 25-fold lower than the lowest dose to provoke an anaphylactic reaction. And yes, this is from a German study again. They challenged 869 children with 4 allergenic foods. Point to note is actually started at 3 to 5 milligrams of protein for cow's milk, egg, wheat, soy, and hen's egg. And they did find 8 to 10% first dose reactors and concluded that overall 0.5 to 1% were at risk of severe reactions. But please note, those starting doses were 33 and 166-fold higher than the vital reference doses for milk and egg, respectively. So again, a very large margin of exposure. And I think finally, yes, the study which Steve mentioned this morning, and which, in fact, of course, he was involved in, the single-dose challenge. And just go in a bit more detail through it. The concept was that it would be run in allergy clinics, and every patient would be attending that clinic for the food allergy, the relevant food allergy, obviously, would be invited to participate. Clearly, they could refuse under proper informed consent rules. And they would be, if they accepted, they would be given this single dose, which was the ED05, which I've indicated on this graph here, as a balance, and that was chosen as a balance between good safety and the numbers needed to be challenged to achieve good statistical robustness. And of course, under those circumstances, there were open challenges. They're not double-blind, placebo-controlled food challenges. So the information that this study was able to generate was the primary purpose, if I remember correctly, was to validate this ED05. But of course, the study initiators, the study investigators realized actually that perhaps not an unintended consequence, but a bonus, you might say, is that actually you would get information about the severity profile at ED05, and you already know what that's going to be because Steve mentioned it this morning. And in fact, that basically the study supports actually the value of 1.5 milligrams ED05 for peanut protein. In fact, it would be slightly more than the ED05. And the results, I believe, are currently being reviewed or have been reviewed and should hopefully appear fairly soon in the peer-reviewed literature. So, moving on now to what's going on in Europe, actually. Now, one of the provisions of the Regulation 1169/2011, the Food Information for Consumers Regulation, is that actually the legislators, in their wisdom, have actually inserted an article which actually aims to regulate such voluntary information as precautionary allergen labeling. There are also other aspects of voluntary information which they do. So, what Article 36 declares is that the Commission shall adopt implementing acts on the application of requirements and so on, referred to in paragraph 2, etc. On the information on the possible and unintentional presence in food of substances or products causing allergies or intolerances. Unfortunately, of course, they didn't actually say when they should be doing it by. So the Commission sort of don't have a definite date yet, I think, or have not been pressed into that. So what is going to, the situation is that precautionary allergen labeling does remain voluntary, as I mentioned before. So it is not mandatory. But there will be mandatory requirements to its use. For instance, the name of the allergenic food. And you could say, actually, the framework in which it's going to be that is going to be applied. So nobody would be allowed to use precautionary allergen labeling unless they stuck with that framework and complied with that framework. And that framework would be shall meet the following requirements. Shall not mislead the consumer, as referred to in Article 7. So not misleading the consumer can mean, of course, omitting precautionary allergen labeling when you should have it. But it could also mean actually putting it on when there is no evidence that is needed. And I think there are, in Europe, certain food authorities who would be prepared to actually go to court to make that particular point if it's necessary. B, shall not be ambiguous or confusing for the consumer. Clearly, the authorities, and I think most of industry actually, do not want to see 39 or whatever number of different statements to express the same point. And then shall, where appropriate, be based on the relevant scientific data. And how do we, or at least how, I should say, how do I interpret that? Well, in terms of the first point, yeah, should be accurate. Its use must be justified. Shall not be ambiguous and confusing, I've already mentioned. Yeah, a few well understood terms. And be based on the relevant scientific data. Use a thorough risk assessment, and preferably a quantitative risk assessment, unless you're absolutely not able to do that. So that's the sort of framework we're wanting to see in place. Now, in pursuit of that particular objective, the Commission, so the Director General for Health, the DG Santé, and the Joint Research Centre at Gale in Belgium, organized this stakeholder workshop, bringing together industry, patient organizations, I don't think we had any physicians actually, and member state representatives, so people working in their national authorities. There were 46, and there were 19 delegates from member states' competent authorities. So a good representation. There are 28 member states still in the European Union, and then, as I mentioned, there's the Food Drink Europe and the European Federation of Allergy and Airways Disease Patients Association, and also actually the German Patients Association were represented as well. The aims of the workshop, which were actually set by the Commission, was, Regulation 1169/2011, and so on, and the observed proliferation of precautionary allergen labeling by food producers, and to identify the sequence of steps for framing the current use of precautionary allergen labeling information. So clearly in line with the sort of things that I was talking about earlier. And we had 3 sessions. One was to discuss legislative and allergy sufferers' requirements. The second was risk-based approaches to allergen management. And finally, the role of analysis in enforcing legislation. And there were breakout groups which discussed the points and came back together later after each of the sessions. And then the following day, actually, we concluded, the conclusions from the discussion topics were presented, actually, on each of those points. So just to go through the conclusions fairly quickly and in a fairly summary manner, particularly since the report hasn't yet been issued. Concerning the legislative perspective on precautionary allergen labeling and so on, I think everybody agreed that terminology should be simple, easy for consumers to understand, so may contain was recommended. May contain is easily understood, both in English but also in all the other European languages as well, I mean, once it's translated. So that was, I would say that would be a fairly easy win. The use of PAL should be subject to conditions, defined conditions and transparent, so should be supported by a documented risk assessment according to agreed principles. Obviously, allergen management procedures should be in place. And importantly, no precautionary allergen labeling statement should be made if the allergen is present below a defined reference dose. It was understood actually that benchmarks need to balance the degree of protection, safety, and choice for allergic consumers, and reference doses need endorsement by EFSA actually. So the points I was making earlier on are understood, at least in this particular arena. And of course, communication to users, both consumers and healthcare practitioners, is critical, of course. No point in having a message if you can't actually communicate it. Talking about risk-based approaches, it was concluded that guidance on good risk assessment practice was needed, and it should be, of course, European Union-wide. It was recognized that protein is a hazard and should be the basis of the risk assessment, not the foodstuff as such, actually. And yeah, stakeholders definitely want acceptance by the authorities of the reference doses defined by VIII, and which you've already heard about. And they wish to encourage food business organizations to use them and evaluate how well they work. And the way that, I mean, because of course you could see that this could represent potentially an enormous burden of work. Well, it does represent an enormous burden of work taken all together. So as not to worry the Commission too much, because they, they have resources and everyone has resource limitations. Their role was to develop the framework based on general principles, leaving the detail to be developed by other stakeholders who've actually already been working in this particular area, to be honest, for quite a few years anyway. The Commission certainly had questions on the readiness of FBOs for application of reference doses. But that's another issue, actually. But it's a bit like a chicken and egg situation. People are not going to adopt them until they think that at least they're going to be accepted by enforcement authorities when they have issues. Now, coming to analytical measurements, comparing results from analytical measurements, it was thought expressed results, the results should be expressed in units that can be directly applied to the risk assessment. So they should be expressed in milligrams of total protein per kilogram of food. And of course, one of the great advantages of that, compared to expressing it either as a total food or individual proteins within the food, is that actually it links analysis to the materials used for clinical food challenges. I mean, you don't normally challenge people with peanut allergy with an individual peanut protein, RH2 or something of that sort. You challenge them with peanut flour. From the Commission's point of view, they thought it could be looked at in the context of infrastructure to support framework. So they've got they've got existing structures, and I won't claim to be familiar with what they've got in that area anyway. But they have something for veterinary medicines, for instance. And they thought actually that the work perhaps could start with priority allergens. I mean, priority in as much as those allergens are the ones that are causing most of the alerts on the rapid alert system in Europe, actually, the so-called RASF system, the RASF notifications. It was also recognized, actually, that there was a need for guidance on good analytical practice, not necessarily so much in, well, I suppose partly in performing the assays, but perhaps also in actually ensuring that if you commission an assay from a laboratory, you actually provide the relevant materials, you provide the proper comparison materials, matrix, samples of the matrix, and so on, so that you can actually get a true value rather than some other value which you can't necessarily trust. Yeah, that's a detail. And they said further workshops were likely needed as work developed. That's, I think, fairly obvious. So just to conclude on all of this, precautionary allergen labeling continues to fail allergic consumers at the moment because we haven't got a system of limits in place that is being universally used, at least not in Europe anyway. But we are moving towards it, I hope. I hope we're closer than we were a few years ago, although I would have hoped, to be honest, that we were actually there. But life is life. All stakeholders accept that this can only be remedied by the definition of and acceptance of thresholds for allergen management. I don't think there's any question about that. Of course, there's discussion on what they should be and how they should be and how much, whether you should take account of other factors, like extrinsic factors that may affect reactivity, like infection, like concurrent asthma, and so on. That's another debate. Yeah, the Vital 2 scheme proposed is scientifically sound and transparent. Well, it proposed scientifically sound and transparent reference doses. And I emphasize, as already been emphasized, they are based on human data. We do not have to extrapolate from mice, rats, or some other species of interest, unlike most areas of toxicology. Developing a scientific and regulatory perspective offers, I think, opportunities to introduce such a proper, robust framework, which everyone can use. And yeah, if we do that, then we will restore the value of PAL, and we'll help allergic consumers, and we'll also help the food industry with it as well. And I think that is the last one. Yeah, it is. Thank you.